Maybe some
Understand.
on the play too. He'll like laugh and stare.
Love it. All right, we are streaming. Okay. Hey, everyone. So this is the June Live Kingston meeting. I'm gonna have us go through a round of introductions, and then I'll bring up our agenda to review what we're trying to accomplish tonight. So I'll go through the person. So I'm Anna Flynn, I'm the Director of Health and Wellness in the City of Kingston. I have she, her pronouns, and I coordinate the Live Kingston Commission.
I am Arlie Fuentes. Today's my first meeting, and I went to the city clerk's office to swear in today. Okay, so thank you for inviting me.
I'm Katrina Light, and it took me like 6 months to sign those papers. So good job. And this is Augie in the corner, giggling.
Okay, this is Kessler, at the City of Kingston.
Anthony Fitzpatrick. My pronouns are he, him, I am a Live commissioner.
Awesome. All right. Nettie, would you like mind introducing yourself?
Here, Nettie Morano, Live Well Commissioner.
Wonderful. Thank you, everybody. Okay, so on our agenda for tonight, 1, 2, 3, 4, we have a quorum for, no, we don't, 1, 2, 8, 9, 4 out of 9 is a majority. Yes, we do have a quorum. So first up, I can hear it.
Well,
4 of 11.
3.
4. Oh, Nettie. In a moment, I can hear a motion to accept May's meeting minutes, which I printed out a copy. If anyone would like to review the part, I think was that this one. Here's the next. Then
May I abstain? Would it mess things up if I abstain? You know, this was my first meeting.
So the approval of the minutes is just that is an agreement that like the minutes are accurate representation of what happened. Like even if you weren't here, it's still appropriate to approve the minutes. The minutes can't.
Oh, I disagree. I think that if that if I wasn't here, it wouldn't be appropriate. You know, if I heard it online, then it would be appropriate. I guess I was here, but I was so dazzled. It's my first time, and I was so dazzled.
I feel like of all the votes we do, this is more of a formality of just saying. We're
I just like to be correct. I like my word to mean something. Candace, what will be done? And so if I may, I'll abstain.
that's totally fine. Okay, do what fit me so you feel comfortable.
And
But then we're no longer.
So then
Put it off.
the motion would still pass because it's a majority of people here. So I think it doesn't.
I thought quorum was the majority of 9.
We have
4.
1, 2, 3, 4, 5, 6, 7, 8, 9. So we have 9. So there's a majority. 9.
5 is the majority of 9.
We don't have a quorum. We do not have a quorum. Take it all back. Do a map.
So we'll come back to September.
Just kidding. Okay. Never mind. We will come back to it in September. Okay. Also on the agenda tonight, I am hoping to have a conversation to review some of our strategic reflection and talk about sort of what we've already talked, like recap what we've already talked about. Maybe dig a little deeper into some mission, vision statements. So that's, I think, going to be the majority of our meeting. After that, I have some draft questions for focus teams that we can talk about if we would like to. And then new to the agenda, we were sent this article written by Kingston Creative about fluoride in Kingston's water system. And Katrina and I sent it to Anita, since she is a medical doctor, to see if they thought it would be something that Hillel would like to talk about. My thought here tonight is just to direct you all to maybe read the article if you haven't already. Then we can decide if Liz Kingston would like to do any action around it in the future. So no push from me to do an action around that item tonight. That's the majority of my agenda. Would anyone like to add anything to it tonight?
I have a question, and want some guidance. This is about basketball, handball courts.
Okay.
Is that appropriate? Sure. I just want guidance. So, I know that there are handball courts in, the Foresight Center. And I know there's a handball court in, near where I live, which is a park with an H, Hutton. So there's handball courts. But handball courts are pretty useless without a fence behind it, so that when you're throwing a handball and it moves and it goes out of bounds, you don't, someone doesn't hit it or someone misses it. If you don't have a gate behind you, it goes all the way out and it's very frustrating. So somebody should know that.
That is something that you could suggest to the director of Parks and Recreation, Lindsay. It also could be something that you could bring to the Recreation Commission.
Okay.
That's the kind of thing often that I think needs to be reported sort of during our planning process. And right now our Parks and Rec master plan is out of date. But that is something that you could, the other thing you could also do is use the city's 311. It's an app, or
yes, I have.
and you could, put it in the app, and then that probably notifies Lindsay, and Lindsay, then it's on Lindsay's radar. That is something.
I'm not taking your time for something silly.
We often talk about other city things, and the parks as it relates to Playwell is really appropriate.
Oh, thank you.
And so,
Which one were you talking about? Are you talking about?
Well, I only know of two. I know there's one in Foresight Center, the Foresight Park, and then there's one in Hutton Park. And I think nobody knows that that's not appropriate. That's not the right thing to do.
I know,
It's useless, right?
Sarah Passy is, the alderman for Forsyth Park, and that's probably one of the things we'd be like, hey, this thing's going on.
Yeah, because handball's a lot of fun.
Yeah, my son's always saying I'm playing it at school, but.
Yeah.
And it's like,
oh, we do have a quorum now. Thank you guys. Katrina and Anita, do you guys mind introducing yourselves? We already went through all of that, but if you don't mind.
Sure. Hi, I'm Katrina Williams. I'm the Deputy Commissioner of the Ulster County Department of Ed.
Anita Slofness, on the family physician, the New Vince residency.
Thank you for joining us tonight. We have a printout of May's meeting minutes, if anyone would like to review it. Or I could hear a motion to approve the notes, if anyone feels ready to.
Motion to.
Yours. I am very good. Thank you. Any extensions? So let's see. You say yeah. All in favor?
I,
You say aye, you can give me a thumbs up. I see a thumbs up from Nettie. Thank you, Nettie. Katrina's, I didn't hear. I saw hands. Great. Awesome. Okay, motion passes. Thank you so much. All right. I'm going to move us on. So I wanted to share with you all that tonight the letter of education regarding SNAP and SNAP Ed has been submitted to the Common Council. It's on their agenda for tonight. Commission also drafted the resolution for them, so it'll be, they may forward that tonight. Michelle Kirsch has said that she would like to sponsor it, so it looks very likely that they will definitely discuss it tonight. I feel like it's likely that they will probably move forward with it and make a resolution, a memorializing resolution. I believe that Kristen and I are going to be in attendance for any education. Last time I'll ask if there's a commissioner that's able to come and advocate or lobby for it, that would be helpful. Because Kristen cannot lobby, and I'm somewhere in between. No one's actually said I can't, but I try to just educate. So that's my official ask for that. Any questions about the letter at tonight's meeting? Any of that? No. Okay. All right, thank you, but I'm excited that we've submitted that to the council. Good thing for the council to consider.
I just reminded that I have this town board meeting after tonight, so I'm doing.
Sure, thank you. Just something else. Okay, that brings me into what I was hoping to cover most tonight, which is sort of a reflection on.
We didn't get to chat about this before coming, but I was looking at the next meetings and wanted to flag the September date for the Live Well Kingston Commission meeting. I don't know if you got to see my email about that. Sorry, I'm like,
Oh, okay.
so Emily and I haven't really gotten to chat as much. September date is during,
Oh, for our CHIS program.
yeah, so you might be planning on hosting the commission meeting anyways, but it's on a convening day, so since all the commissioners are here. Just wanted to flag that.
Great, thank you for that. Yeah, so we have no meeting in July and August.
Yeah.
I think that I don't know the answer to how busy I'll be for the CHISCA meeting yet. So maybe I'll work with the chair to see if we need to move it or not. Awesome. Okay, so
The only other agenda item, wasn't there another, we said we're gonna update everyone on things that got signed?
So no letters, no other letters of support happened, but on the bottom of tonight's agenda, you'll see the email vote to approve party has been documented. So that is there. I don't think there's any action that we need to do. The action happened via email, but it's been documented. Yes. Okay. Questions or thoughts?
I'm moving that. Do you think it would be appropriate to talk about the LFP
Yes,
application during this meeting?
yes. Can we put it in announcements and communications?
And then have them before 5:30 p.m. Is that possible?
Okay, then you know what? If you all are all ready, do that first, because I think that the strategic reflection may, be a dense conversation. Do you want to keep it to 10 minutes?
Yeah. Oh, and maybe this may not have to be that long. Sorry, I'm like blowing up your agenda. But I can, okay, I don't even think we need. Wait, I'm going right now, right?
Yeah.
Okay. So, the city of Kingston is applying for a grant. So this is through the USDA. They have something called the LAMP grants, and that is Local Agriculture Marketing Program. And it's a portfolio of grants that they offer to, to help increase, healthy eating, like local food. Essentially, well, there's one that's called the Farmers Market Promotion Program. That's like the most intuitive, I feel like, of the names. The one that we'll be applying for is called the Local Food Promotions Program. And the grant application that we will be submitting for that I'm still working on, is there's been a need through doing outreach for the food systems plan and some work that the Kingston YMCA Farm Project has done for more commissary kitchen spaces. So Kingston has this really robust, I think very robust, food, food system with small food businesses, but we don't have a kitchen space that food businesses that are not a brick and mortar are required to have in order to get a health permit. So think all of the small food vendors that you see at the farmers market, a lot of those places don't have their own kitchen. It doesn't make sense for them. So they have to have a commercial kitchen space that has been inspected and permitted by the county in order to operate to make their food. So in Kingston, we have a couple of them that are already existing, but one of the biggest barriers is that people just don't know about them. They don't know who to contact for them. So it's every small shop, small food business shop that I talked to was this is a real need for ours. There's also nonprofits out there that use them, like Angel Food East. There's just a lot of need for this kitchen space. So we would be applying for this grant in order to create a network of these kitchens and support them through technical assistance, through peer-to-peer learning, through exploring and purchasing or subscribing to a platform that would allow small food businesses to go online and find what kitchens are available. And so, one of the big problems is capacity at the kitchens to be able to manage that. So we would facilitate that with platforms, really making it easy for folks to get over this hurdle of this like middle of the process with like getting the kitchen. And so we would do that. I think a big part of this is really encouraging local food. So we're figuring out what it would be like to have, anyone who's a part of that network and receiving the support. Also through sub awards for equipment, so like money to purchase things to help build out their kitchen, that they would sign this like pledge or commitment that says that they would like to prioritize local foods, would provide assistance on that, like connections with local distributors like Red Farm Produce, or connecting them to Milestone Mill, or like just kind of all of that whole process and make it easier. Once again, just for like small food businesses to be connected with these kitchens, just to like, bridge that gap. And at the same time, building in funds to build out the kitchen at the Andy Murphy Neighborhood Center, where we currently do our community cooking workshops and have hosted farm to institution trainings before in the past. That would help us to continue to buy more equipment, to just put more resources into actually utilizing that space more frequently and a better manner, I guess. So that is the grant that we're looking to apply for. It's a 3-year grant starting September 30th, 2025 through September 30th, 2028. And let's see, anything that I'm missing about. So it's reaching out to like community kitchens in the area, like the Old Dutch Church and Community Action. Doug just got back to me, was like, that sounds amazing. He's the executive director for Community Action. So yay! I know, the fact that he responded, although like within like 30 minutes is like, probably said, I was like, we'll give you equipment if you join.
Yeah. Did you get a text about the maker space?
Yes, yes. So I'm going to message them back. So it's like there's been so many people like coming from different directions, really just talking about this need, and it felt like it really aligned with the grant's purpose. And it also is one of the strategies listed in the food systems plan. So it's kind of like a nice way, like, as we're getting the food systems plan up and going again, that we can show we're already trying to get started with it. We don't need to wait, but this would be part of like Live Well Kingston would be part of this because Kingston Cooks and Kingston Eats, these local eating and cooking initiatives are under Eat Well. So we would be really working through like exactly kind of the connections there. But I imagine it'll be connected to Live Well Kingston in so many ways.
And it's due by the end of June.
It's due next Friday.
Yeah. Sure.
Which is why I seem disheveled and crazy. But I think, like I said, it's something that like so many other inputs have been coming in from like different directions, and people who have been asking about the kitchen at the Andy Murphy Neighborhood Center and asking about commissary kitchen spaces. So it feels like it's a really nice alignment, like grassroots, like coming from community in so many ways, rather than something that like we just wanted to. But I don't think we want to do because yeah. Any questions about that? Great. I mean, we'll see. I don't know. We have to apply. It's not like we have the money, but I just wanted to let the commission know about that because we're writing about the commission and Eat Well and so forth. And application.
Oh, I'm sorry. Whose grant is it? Like who's providing the funding?
The USDA. Yes. I know. It's interesting. Yeah. Did not think that they were actually going to offer it again, but they did. So here we are.
I guess I was going to add, we're unsure of the CHISC funding. They have not announced that. So if we get this grant, I think it's some job security for Kristen. So I think we're envisioning that Kristen would go into this 3-year program. And then if the CHISC grant opened up again, we would configure if we wanted to hire someone else or Kristen wanted that one. I really think Kristen can decide what she wants to do. But so it is big enough that it would be a full-time position in our department.
Yes. Yeah, we're building one FTE into it, which I think would be fantastic because CHISC and the food systems plan, it's like different work, like CHISC ultimately is public health and sometimes overlaps with the food systems plan, but it's not the same. So I think by building in one FTE for this, it would really be setting the city up well to have a staff person who can help to see the plan through. So also, yes, if CHISC is not offering again, it'd be like real cool to like keep my job.
What's the timing on finding out of both of those grants?
Yeah, I had to remind you, I had to look this up. So the grant period for the LFPP grant starts September 30th. Did not remember seeing in their RFA when they make the announcements on who's received them, like you would imagine it would be before that, but it's right. Like, well, I know, right? Also, like you would imagine it would be before that. Will it be before that? The CHIS grant, we've just been waiting on the RFA for a long time. It might be coming this summer, but also because the CHIS grant gets 35% of its funding sourced from SNAP Ed, and it's not looking like SNAP Ed's going to look back at the budget, whatever that RFA looks like, it's going to be significantly different. So, so we don't actually have any from the state. We don't have any confirmation. The State Department of Health when RFA will be released.
And the CHIS grant ends.
May 31st, 2026. Yeah, so we've got about a year left.
So good. It's a big cross.
Yeah.
And you sort of designed this program thinking that you at some point you sort of like cross.
Yeah.
Scale one down, scale the next one up.
Yeah,
So actually
yeah.
the timing of the grant, if we got awarded it, for us.
Yeah, it'd be kind of nice because it would be like a little like a rolling start, like starting September 30th. Also, I feel like federal grants are like always late.
Yeah. I think our contract often takes so much longer than we anticipated.
Yeah, so it would kind of like be, it would like a rolling start, restarting the way I planned it, like in earnest, like June 1st of next year. We would be like gathering all the pieces. Oh, yeah, I think it'd be great. I mean, even one of the collaborators that I identified in Teaching Kitchen at the Lennoxville Neighborhood House, they're the ones who provided the farm to institution training that we did last year. They're such great partners. So they had reached out to us to be a letter of commitment for their LFPP grant. And I was like, wow, that's great, because I was writing you into my LFPP grant, and you're allowed to be collaborators on as many grants, I think, or there might be a limit, but it's more than one. You can only be the primary applicant on one grant, you can be collaborators on others. So I'm hoping that they see it as like oh, look, these people are both doing great work and they want to do more great work and they're able to plan to do it together. So we should.
And their work is different and complements both projects.
Yeah.
And is regional.
Right. Yeah. So like they're based in the city, but they're expanding to the Hudson Valley. And exactly, like we're doing different work. So it wouldn't be duplicative to fund both of us. But if they funded both of us, it would be, I think, like not exponential, but more than what this one is. But yes, it would be additive if they funded both of us to do this work. So I think, just like so many things are coming up. That would be really cool.
Alrighty, okay, thank you, Kristen. Thank
you.
you. Give us an update on that. That did come up very quickly. In fact, I think we didn't know that we were going to be applying for it during our last meeting.
No.
Okay, so, as you may or may not know, we've been going through this strategic reflection. Wow, it's taking a long time to catch up. There we go. And I wanted to come back and review some of the things, some of the decisions we sort of made, or keep refining, keep drilling down on some of our strategic reflection. So up on the screen, I have the Live Well Kingston vision that's on the website, and it has been the vision for the last 7+ years or so. The old vision is Live Well Kingston envisions a community environment that promotes and supports healthier lifestyle choices. And then when we met in November, we sort of did a longer meeting and we did some strategic reflection. And this is sort of what we had identified at that time. And I'll read this one. And this one would be Live Well Kingston envisions a community environment where there is easy access to healthy and enjoyable food, safe, active transportation, welcoming public spaces, and community connectedness. And so there must be a good scene happening. And so my first question to you is, how do we feel about changing the vision? Do we want to change the vision? And if so, do we like this new vision first? There's a few other questions just so you know where we're going. Then I'm going to talk a little bit about, we've been calling them goals for the focus team, but they're really missions for each focus team. And I think it'll help us identify what each focus team is. But so first we're doing vision, then I thought we'd look at the mission, and then we go into each focus team's kind of mission.
I like the new one better than the old one.
Cool.
I have a rookie question. what do we mean by community connectedness? It sounds like what you were just talking about in your proposal, Kristen, for your grant.
Yeah.
To know how to do something or how to get at this,
Yeah, definitely.
how to get a resource.
Yeah, I definitely think that's one of them. I don't know, and we were.
Do
you want
I was like, I didn't write this, so.
We met and together, and that was my question too. I was like this, but then I realized that the connectedness piece is actually like our communications piece for this commission too. Is like we've talked a lot about like having each focus team know what the other focus team's doing and being a resource to community members about everything, all the great things that are happening under this umbrella.
So this commission would be a resource to the city of Kingston, to the rest of the residents.
Be a resource of the city of Kingston. So when we were thinking about the focus teams, in a way, there's like another focus team, which is that communications piece. And we'll talk about more of that, like roles, things like that.
Well, and if, I also see it, the community connectedness does feel vague to me, I agree. The coalition building that happens, so this meeting, the focus teams, like, to me, I believe is a sense of community connectedness. I also think everything that we do with that touches the community is community connectedness, but I know that's really a broad web that I'm putting out there. And then to Katrina's point, I think specifically it's the communications, and if we did this new structure where there's a communications chair, there might that might morph into a group. It could just be the person in me, or it could be a focus team. So that is the community. Does that answer?
Because we've talked about like, having a website of all the events that are happening, or somehow like consolidating all the things that are happening. And
I was gonna say too, to offer up, I don't know if it makes sense for here, and a webinar that I was in, so like community connectedness, social connectedness, I feel like it's like a big hot topic right now in like public health. And there's this organization called Foundation for Social Connection. And I looked them up, and they might be interesting resources to consider because they have social connection measurement tools. They have a whole inventory, so it could also be like a measurable like piece of work as well. So I imagine that's interesting that you're asking about what community connectedness was. And I think that's like maybe a little bit different, like the social connectedness that they're listing here versus maybe what's being described here. But
Measurements are good for grant writing, I guess.
yes. Yeah.
And also when we talk about the purpose of all the focus teams, like for them to eat well, the purpose is just to like meet and network and communicate with each other. And so that kind of falls into this too.
Other thoughts on the new vision?
I like it.
All right, well, why don't we keep going? We can always sort of come back if new thoughts come up. I think as we go through it, we might want to come back in a little bit. So my understanding of sort of the roles between vision and mission, the vision is sort of where we want to go, and the mission is how we're going to get there. And so our old mission is Live Well Kingston brings partners and residents together to facilitate policy, environmental, and systems change that result in a healthy and active community. I feel like that's still maybe true. I feel like that's how we will create a healthy environment with these end goals. And we may still do it this way. And then I guess it feels a little broad. Healthy and active community feels a little bit open, but I still really like the policy environment systems change. I don't think that we should change that. Feedback on mission statement?
I think it pushes us more toward the policy piece that we've been dabbling and scared.
Yeah, it seems good to me. Okay. All right, keep going. We'll keep coming back. All right, so now digging in a little deeper into each focus group. So as you all may remember, each focus group sort of started to create in the past, we call them goals, but really as I think about it, these are missions because it's not specific. It's not the SMART goals. but it's more like what each focus team was hoping to accomplish. And so I can read through these if we want, but you know, each one was very different. There's play well, age well, and heal well. I can, would you guys like me to read them or we'll come back? Okay. And then that brings me to what I feel like we've sort of identified in our most recent conversations, that the new focus in our November meeting, we had said that it was two groups of things, that it was healthy food environments and active transportation and public spaces, but actually public spaces and active transportation to me feel like different buckets. And then that, as we were just talking about community connectedness, I would say it's sort of a fourth bucket.
What
So-
is active transportation?
To me, quickest answer is walking and biking, but it can include skateboarding, scootering. So it's transportation.
Non-motorized?
It's non-motorized transportation.
And the same question.
Yeah, it's one of those phrases that I forget that it's part of my language now, but thank you for asking. It's an important one to ask. So those sort of seem like the four refined focuses.
Human powered transport. I was just thinking of something that wasn't jargony if we went to the host thing, but I don't know.
Yeah,
I mean, active, when now that I know, it makes sense because it's like you're being active.
yeah.
But
It's about physical activity, so it's using some of that language. It is a phrase that's used in the transportation world, but it is definitely. So there's a better way to, we do have an underlying value of having communication that is very readable and accessible.
Right.
So always welcome to new language.
Yeah, I think if just said physically active transportation, I would know what that.
Okay, that's an interesting.
I feel shy of being new, whether I was thinking I should shut my mouth today.
No, Arlen, you should not shut your mouth.
Well, you people were foolish enough to invite me in. Now you're in trouble.
Arlen, you always have great questions.
Well, I like non-motorized transportation. I think that's so clear. And community connectedness, it smacks me as jargon. And if we were thinking about communication, I would rather just have the word communication there.
I agree with you. I think connectedness may be a phrase that it seems to be common in some of the rules, but I have never heard of it before. I think, what's wrong with connection?
Community.
Or even social, because in the mission statement, it's like, this almost, it seems repetitive, say,
So.
because you're
So public spaces and community connection, or just connection? And communications?
Communication. I like communication.
In the vision, I don't get specific enough. It's saying our goals are healthy and enjoyable food, active transportation, which maybe we change those words, welcoming public spaces, and communication. That's just like that is even more white to me than talking, or I think what we're trying to get is like this connection. Doesn't have to be, maybe it's just simply getting rid of commitment, replace whatever.
social.
And social connection?
But then I think about like online platforms too. I mean, which I guess is included.
Yeah, that's something extra. Loneliness is good.
social connection better than community connected, that same thing.
And is social connection also the communications?
Could be.
Nettie, are you chiming in?
Yeah, I was trying to figure out how to raise my hand and it will not let me raise my hand.
Yeah.
Anyway, I think the word community is really important to keep. Community is the only thing in there that says all of us. And if I were to change the phrasing, I would call it community connection. Like, yeah, it sort of to me, it addresses there are various neighborhoods that need to be connected. Yeah, that's my thoughts.
Nettie, do you say that community is also listed as upfront? Like there's two communities, Live Kingston Visions a community. Does that satisfy it if there's
No, because you say community environment, and I think community connection talks about people.
Hmm.
I think we have to talk about people need to be connected. What I think. Just my thoughts.
Yeah,
I would try to avoid using the word community twice, though.
yeah, it feels clunky to me. It sure, this feels what? Clunky to have community in their choice. So sort of usually when you're writing, you try not to use the same word twice in one sentence.
Yeah.
Community conditions and environment. And then community at the end.
Yeah.
Or even envisions a city.
I was gonna say
Oh, a
cities
city.
too, yeah.
This is a city. Oh, that was good.
Like that a lot, actually.
Great, so no community at the top like that. And maybe and community connection at the bottom.
Connections. So that it to me that represents the different areas of town connecting, because we are kind of spread out. Different neighborhoods have different, different sets of handling things, or neighborhood policies or whatever. But and also different kinds of people. So maybe the connection and community together, to me, talks about bringing everybody to the table.
How does the Livewell Kingston, I guess my pushback is like, I don't know that we are actively working towards connecting different neighborhoods in Kingston. I think we're doing it informally.
Okay, maybe inclusivity is a word. Like we to include everyone is what we're trying to say, yes?
I don't know.
No? We're doing this for everybody, not just some, I guess is what I'm trying to say without using too many words.
But
in a
it's just,
sentence.
the goal is, it's really to address like health issues in a way, right? It's really about like getting people feeling and being connected more than like the goal of like from a systems perspective, bringing the community together. It's the way that I think about them. Wow.
Well, and I think with a mission, that's more like this broad strokes, like we want we want everyone to be happy and healthy. And I think the vision, we're really trying to like hone on the measurable things.
Right.
And so what we're trying to do with this community connection piece is to be able to say, we created this website, we did this newsletter, like those are right now our measurable tools. So I want to make sure we're staying in that category. Because the healthy, enjoyable food, we could say, we had this many events, there was this many posters, transportation, these are the 4 new bike paths, welcoming public spaces, there's 2 new parks. Yeah, I think we're kind of arguing about semantics, but it's important. It's just as long as we are able to stay in the realm of what that communications piece is.
And I know we don't have Heal Well any longer, but it seems to me that it would be still nice to include like overall health or even wellness, because if we work on I know we mostly work on these areas of food and transportation. But we also have the HWell, like senior health. So I wonder if we even said something like, Livewell Kingston envisions a city where there's easy access to healthy, enjoyable food, safe, and connect this to improve the overall wellness of our population. Because then if we work on things like the fluoride, which honestly has been like a big interest of mine for years, or other health issues, it gives us a little bit more broader scope.
Yeah, it feels important. I feel like ending it the way that you just described kind of makes it more well-rounded in the way I think that we envision the commission versus it just being about like food and transportation, which is how it would feel for me without.
Also gives you like an end goal of actually having like healthy people. Because you can do all of these things to create easy access, safe active transportation. And that's where the notes are like, it's hard to measure this, like how can we measure actually the impact of the commission, but I think the idea is to have healthy people.
Right. And like, if we did all this and people aren't, right, to your point, I love that point. If we don't have a healthier population, why are we doing this?
Right.
Yeah. Yeah. So I captured that, improve overall wellness in the population of our population.
Community connection
To
in
me,
order
it's
to.
different within population, but that was some meta to me.
Oh, yeah.
That feels like a little jargony. I know that it's like, I feel like it was like used in like my nutrition like courses, but.
What if we just said in community connection?
In the community?
We just got rid of.
Wellness.
We said
The wellness of our neighborhoods.
connection and then
I
the what?
wouldn't want to neighborhood. I think it was an idea.
Well, we can also take out the other two communities if we want it. So the first one's city, the second one's connection, the third one is.
Yeah.
For our, like, in order to have a healthier community.
Mhm.
That's our only.
So improve wellness.
So would you want to reference what we have? Are you able to
Yeah.
type what we have now?
We don't have our secretary.
Yeah, we don't have, I think I'm not gonna do that tonight. Here, I think what I'm gonna propose is that we are having a great conversation right now. I'm gonna review it, maybe I'll work with the chair and we'll present this again in September and we'll reflect again with a new draft. I'd rather do that than try to go in there and see the level of stuff.
But yeah.
And maybe change the maybe change safe active transportation to safe non-motorized transportation. Would that be appropriate?
In the vision,
Yes, new vision,
so you want to change safe active transportation is what, so
non-motorized.
Or physically active. That's one of their.
Oh, I guess that wouldn't be appropriate because we're thinking about electric bikes and things.
non-motorized.
Right. Also, like, I don't know, I've not been part of travel out really, but I think I went to one. But part of it is also like considering motorized transportation to make it like safer, right? So like, I feel like
Right.
we don't wanna like exclude. That's like part of, speech.
Safe transportation, that'd be appropriate.
Well, I mean. Yeah, your points are, your really valid points, Arlene, and I think my struggle with it is that I've been using the term active transportation so long, it's hard for me to move away from it. But yes, and in fact, transportation, age well right now is not actually active transportation, it's actually, they're working on transportation.
Ride shares and
And
stuff.
aren't you guys working on pedestrian safety?
We are, that was,
Would include just
Motorized transportation.
yeah, right. So safe transportation. Maybe what is, I have to think about this a little bit.
I don't think it's wrong keeping it as long as there's a definition somewhere near it, you know, I think that
Yeah.
once because we have this and then we have our buckets.
Yeah.
That's kind of where we get more in
Yeah.
depth. We want to talk about what we were thinking for each one.
Sure.
Yeah, I think removing the word active, to me, it like loses the part where we're trying to support and encourage people being physically active, because ultimately this is a health and wellness commission, not a transportation safety commission.
Yeah, sure. And I don't want to get stuck into like airbags.
Yeah, like that's important for like health, but like,
Yeah.
yeah, but this is,
Car seat safety, we're not doing that.
yeah, and I guess like this has like nutrition and food and like physical activity is such a big part of it too. And so you include physical activity without saying it, but I think by removing active, like, not that it has to stay safe active transportation, but that's where a little bit of my concern about
Yeah.
active is.
That's good, all good.
I just want to say that I use transportation all the time and I explain it to everybody.
Yeah, but it becomes all of our attention.
Yeah, right. It's intuitive, like,
Yeah.
I don't think it's like a crazy one, but it is.
So I feel like I've documented some of this wordsmithing. If you all don't mind, I'd like to take another pass at it, process it a little bit. I'll bring you back another recommendation if you want. Arlene, you have some great ideas. Maybe I'll try to reconnect with you to review it as well.
No, Brandon.
Do. All right, great. So that's the vision. So thank you for that. I want to limit this conversation to another 15 minutes at most, just so you all know. So if we need to, we can come back to this again. There's no urgency on this, but I'm glad we're having this
We
conversation.
wanted to come back to it because we kind of talked about it in December.
Exactly.
And our next meeting is in the fall and we're hoping to. Start this teams and it's all gonna happen sooner than we think, but the year will be over.
So what I'm hearing is we may change some of this language and some of this language, but it does feel to me like we are having clarity on what they mean to us, even if we don't have all the words in this moment. And then we were going into, this was my way of looking at our current focus teams and how they fit into these new missions. So Eat Well and Grow Well to me are part of healthy food environments. And I've asked Kristen and Ninette to review what they think is the mission for Eat Well. Is it improve physical, social, and economic access to healthy foods? So they're going to meet later on and review that a little bit more, but also hear for feedback from you all and your thoughts on that. And then to me, Grow Well feels very clear that it's about increasing access to community gardening, gardens. So that feels clear. Questions about healthy, what I see as would be in the healthy food environments sort of focus?
Can I just ask, what is social access
Social access?
to food?
Yeah, so that was through, oh my gosh, what's it? Oh, I have to remember which international body definition of access. So this idea that like when we speak about access to healthy foods, it's always physical access, like are there enough retail stores? Obviously economics, like are they affordable? And social is, you know, are they foods that people desire? Are they, this cultural relevancy of food. So a broader definition of food access than just physical food access.
Play Well, so this is the accessible public spaces. Play Well to me is about increasing access to parks, and access is in a number of different definitions. Active transportation, or whatever we call it, to me feels very clear that it's travel well. So I've seen travel well as increasing access to active transportation, walking, biking. And in Age Well, this year, the main project has been increasing active transportation for seniors. So that sort of feels clear to me in that grouping.
Oh, that's their focus, is transportation. Oh, interesting.
There's just one, Age Well has narrowed down to just one project this year.
Oh,
They're just recruiting for drivers for the neighbor to neighbor program that the Office for the Aging runs. So it's increasing transportation options for seniors.
great.
Community connectedness, that's what we were talking about a little bit before. So this was sort of my explanation of what I thought community connectedness, but we may change that language. So that was all that I thought we would cover tonight.
So, is it worth sharing a conversation around demographics? And
Sure, please.
I think when we were looking at the groups, they all kind of had this central theme of increasing access, except for Age Well, which was about a certain group. I was like, well, why don't we have Young Well? Or like we were just kind of like riffing on everything else that could exist, and maybe proposing that like Age Well turns into a different group, like maybe it gets combined with a different group because when we looked at it, it's like Age Well is about having healthy food, healthy transportation, all these things for a certain group.
Yeah.
Because you could also say that for like BIPOC or youth. Yeah. And so it's like the one that doesn't fit when I was like looking at other, because we're also thinking about like a lot of cities are kind of like looking at their wellness communities and maybe shifting some things. And then it's just one that was like, this actually kind of sticks out as a group of people instead of an actual like doing.
Yeah.
Because a group of people can be fit into anything. It should be really inclusive. We should be talking food for youth and elders and whoever culturally relevant within each group should have this. So I don't know. It was just like the initial thought. It just came up and was like, oh, we have a shoot before. So no proposal or anything, but just wanted to share a conversation I thought was interesting around like we talked about, maybe having different focus teams at the end of this year. Because we, and heal well, or like just kind of reworking so that it all kind of fits nicely.
Yeah. I guess my curiosity, not knowing very little about any of Age Well's work or OFA, if I'm honest, I mean, I know a bit about it, but you know what I mean, is like, how does the overall county office like see age, like Does it feel duplicative? Does it feel like something that could be folded in? Because I agree with you. So I feel like, can that work still happen, but just like under a different umbrella? Maybe.
Because right now.
Because it's countywide anyway, right? The initiative that's being worked on this year is a countywide initiative, the Ride Share program. So I wonder if it really fits under the vision of Live Well or not.
It does it within travel well in some ways, like it's.
Sure.
Yeah. Because you can have a specific, and then maybe next year, Age Well does something around food around, like it can still exist. And if people want to meet on their own, I don't think there's anything wrong with that. I just think as like, if our job as a commission is to like streamline and make things make sense, that one doesn't make sense in the communications side of it all.
Nibby has come unmuted.
Yeah, and I don't want to, I don't want to feel like.
No, I just wanted to make sure everybody knew that the neighbor to neighbor program, ride program, is just for medical appointments and just for non-emergency appointments. So it's a very small little project. I also wanted to point out that we have quite a few, and you will know them much better than I do, Emily, our stakeholders in Age Well, just a wide variety of services that are out there for seniors and other communities that join with us to just at least know what's going on. And we kind of use that as a communication source. But I can see where year after year, we can pick a project for different entities, different stakeholders that need help and focus on that. So we don't have to try to figure out something new, but we can assist them in what they want to accomplish, that they will manage and we will just assist. And maybe that doesn't work for Live Well. I don't know, but it seems to be a good way for us to at least be involved in that, at that level of what they're doing and how we can help them.
That sounds like community connection. Well, it's you're going out to community, asking what the needs are, and then filling that gap specifically around seniors. Like, I don't think that work should go away. I just think as far as like where it fits in, it just might change a little bit. It's because it could very well, you could keep meeting with whoever you want to, and it could be under the community connection, just pull it so that it. Because eventually someone's going to ask that question of like, yeah, why not these other groups of people?
I can't answer for Office for the Aging and how they see the value or not of Age Well. In our last Age Well meeting, Susan Copenhaver, my apologies if I'm mispronouncing your last name, who's the director of the Office for the Aging. We were having a discussion about how it's hard to get a lot of people to come to these different meetings and coalitions. Yeah. And she helps run the care coalitions.
Care meetings that are called the same thing. I mean, that's just a good example of, I think, part of the problem, right? There's two meetings that do two different things called the Ulster County, whatever it is, what you're talking about. Yeah. So I just wonder, and it's not my job to streamline their work, but I just wonder if there's like similar work happening in committee meetings where it's hard to get attendance.
And one of those is talking about senior transportation.
Right.
So it does feel duplicative, except that I do think Nettie and others, Anthony and Arlene, have done outreach and have done some real tangible support.
Oh, I'm sure.
So the work is wonderful, no question on that. It's really about sort of like, and I also sort of feel like Age Well, right, a little bit like Heal Well, the Office for the Aging is the main source of all those resources. And so wish they had an Age Well for the county or their care coalition, maybe whatever they want to call it. It has always felt awkward to me that the city has its own Age Well group.
Yeah.
And is asking Office for the Aging to participate, when I sort of feel like maybe they should run
the other way around. Yeah.
And that's the communications piece. If you guys are doing outreach,
Yeah.
you're doing communications for a community partner, which is amazing, but it's communication, so it's connectedness. It's not creative.
I feel like your words have been flowing over me for some minutes. I don't know why I said it that way. I'm really tired. But it just, I was trying to, what is the word that I was thinking of? And I feel like what I've seen like employers having like affinity groups. And like that just like makes so much sense. So like affinity groups like at different employers, it's like oh, there is like the BIPOC, there's like the queer group, like, and then I see how this is like separate from like the WELS almost in a way. And that makes it more inclusive, and I think it makes it more easily definable and like make it more like attractive to people in Kingston who want to participate, but feel like their affinity group, like their group is not really represented, even though like it might be, but like that, I don't know, that just makes a lot of sense to me. I don't know, sorry, I just felt it. Just felt it.
I mean, when I was talking, I was just like, oh, right, like this is just
Yeah,
doesn't fit.
well, and we like
Right.
talked about like wanting to diverse, oh, sorry. I was like, we've shown that like, we've done surveys and we're like, oh, it'd be really wonderful to have like a more diverse representation in some ways for participation. That's might be a way to help package it.
I feel a little uneasy because I feel like seniors, I mean, we're looking at overall health and wellness, and seniors have such a disproportionate amount of illness. And they're very vulnerable. You know, they really, you know, I know that this is a good project, but they still can't really get to events, and they can't really, they're often very isolated. And I know these other groups also have specific needs, but this is a really large population. I mean, Kingston, Ulster County, I think, is older.
And there were some new reports that just came out that Ulster County is aging even more.
I just want to open us up to have that argument of being like, well, this is more important for health.
No, but I just feel like we need to, I don't want to, I just feel like we need to include, and if it's just, you know, if HL is just helping with the communication between the Ulster County Office of the Aging, and I still think that's important, because I feel like we have to really recognize that seniors have, you know, probably the largest unmet health needs of the population, just because of their age and isolation.
Yeah, I don't think the work.
Two points. One, I read recently in Ulster County, there are 60,000 people over the age of 60. That's a lot. And the other thing I just wanted to point out was of our group, the different stakeholders, I think the one thing that you could say they all have in common is to prevent seniors from falling through the cracks, the vulnerable ones. I mean, there's people like me, we go to dance class, we go to yoga, blah, blah, blah. That's not for me. Age well and that group. It's to help the people who don't do those things, who can't do those things, who don't have access to those things. So it's a mix on the population. But I think that's the goal there, is to make sure that they can keep as many seniors as possible from falling through the cracks.
And again, I mean, correct me if I'm wrong, I don't think anyone is disagreeing that it's a value of great work. I think we're trying to feel through a little bit of how we describe it, or and there is a little bit of limited resources in how we allocate them. So I don't know.
Showing up to meetings and what's the actual thing that's being done, because at the back end of all of this, I'm thinking about how do we measure these things on this like website and this report, like how are we saying we did these things? And it's a great group, you're doing amazing work, it's around communications, like it's just not, you know, and if only a couple people come, or if these other groups already exist, like I just think there's a way to to demonstrate this differently without taking anything away at all. Besides maybe a name.
Yeah, I was going to introduce Alex in just a moment. Yeah. So I think it's just about time to wrap this up. And so we're not making any decisions tonight. I thank you for this conversation. I think every time we touch on it, we look at some other lenses around it. So I think this has been a really great conversation. Any last urgent thoughts or things? We'll probably try to pick this back up in September, so you get some time to let it sit, think it through a little bit.
Yeah.
All right. Otherwise, I'm going to bring us to our new agenda item. And I'm so thankful. It looks like Alex is able to join us. Alex, if you're there, enable. I saw you Kate, yeah, you had a camera there. Alex, you sent me this fluoride in Kingston's water system article. Would you like to speak to it for a few moments?
Sure, I'd love to.
And introduce yourself, please.
Sure. So I'm Alex Panagiotopoulos. I'm from Kingston Creative. And many years ago, Emily and I actually worked together at some of the earlier days of Live Well Kingston. We did a number of articles and social media content for Live Well Kingston about some different interesting things going on around town. So a few months ago, I came across some information about Kingston's history in establishing fluoride as an extremely safe intervention for populations of kids to have protection against tooth decay. And Kingston actually participated in the landmark study for 25 years between Newburgh and the city of Kingston, where we established for the first time that fluoride was safe in the United States. So it was a very big deal at the time, and Kingston was the control city. So we didn't have fluoridated water, Newburgh did, and they found at the time that Newburgh's kids had about 50% less cavities than kids in Kingston. So a huge public health benefit. And right after that study, cities all around the country were clamoring to get fluoride, to fluoridate their water. And Kingston just never quite joined on. And in the 60s, a number of conspiracy theories and paranoia, theories were kind of going through the country saying that fluoride was a communist plot. It was a plot to invade our precious bodily fluids, which is from Dr. Strangelove, the famous movie. And so Kingston's Common Council, it came up a few times. It was advanced, but they never were able to vote it through to authorize the fluoridation of Kingston's water. So actually, Ulster County is one of the lowest counties in the state. I think only 3% of the community water supplies in Ulster County are fluoridated, compared to 80% of Westchester's community water supply or 50% of the rest of upstate New York. As a result, our kids in Kingston alone have had thousands more cavities than they would have if we had fluoridated water. It costs families millions of dollars. The disparities are especially bad for low-income kids in Kingston who don't have access to dental care or fluoride treatments. So, right now, sometimes it seems like fluoride is an extremely unpopular topic. With what's going on with the presidential administration, RFK Jr., very against fluoridation. But last year, the city of Albany actually showed that it's possible to still fluoridate your water as a new city in New York State. Their Common Council unanimously authorized the fluoridation of their water supply I think they have 80,000 people there. There are New York State grants to do engineering studies and to do the technical implementation of fluoride. It's not a money thing. It really is about the literacy of a community, the ability to communicate benefits, the ability to read and communicate studies that show that it's safe, and to be confident about overcoming fear in the name of our kids' health. So I wrote this article that Emily put into the agenda. Thank you, Emily. I appreciate it. I'm sending it around to the Ulster County Health Department, to the Kingston Common Council, to the Water Department, because I think we should take this issue up again. It's been 50 years since Kingston considered this seriously. And I'm curious if it'll be even more unpopular or it'll actually be a slam dunk today. I don't know, but I want to find out. And I thought Live Well Kingston would be a good place to put this issue out there. Thank you.
Thanks, Alex. Any questions? Anita, you
No, I'm so thrilled because I've been really, really interested in this issue. Well, ever since I moved to Kingston, which is really only 5 years ago, but I could not. Honestly, I've only worked in cities with fluoridated water supplies, and no one, when I was in Kingston, mentioned to me that the water supply wasn't fluoridated. And so I don't know how I first figured out, but then we've been prescribing fluoride to our kids in our practice. But I don't know if anyone else really, who else is it? I mean, what other providers in Kingston are, but I know about the study, and then I've been trying really for a couple of years to talk to the water guy in Kingston, because I really felt like I wanted to confirm this. So the fluoridation data is actually a CDC. It's on a CDC website. It's county by county by county. And I just really felt like I've been giving kids fluoride and then God forbid, I don't want to give them fluoride toxicity. So it took me a couple of years, believe it or not. I mean, I wasn't working 6 hours a day, but I had on my to-do list every time I had some people call me. He finally did. I just spoke to him last month and he did confirm a couple of years too late that, well, I've been prescribing fluoride. There really is no fluoride. And the CDC has since been fluoridated. He said there really isn't any fluoride in any county. There's one little, I forget, I have a folder, a fluoride folder in my office. So. Yeah, I love this idea. I really think we should. I can't, you know, and I presented that data on fluoridation. I presented data last, you know, it's really, really low. And there's no real data on dental decay, but I'm sure. I don't even know what practices are doing fluoride. Varnish. I've been trying to get it in. I've been able to get it. But I do prescribe fluoride. That's like to drop in the bucket. But yeah, I agree. And I wish it was not, I think it's going to be harder now with, you know, the federal government.
But even before the administration changed, like I have an 8-year-old and then I guess sort of hippy dippy and I don't know any, I'm like, it's like so norm for like a lot of the moms that I know are like scared of fluoride. So like, I don't know what's normal in terms of like what the community response would be, but that has been my experience. It's like,
yeah, I do think it's harder because there's so much misinformation.
Yeah.
But I mean, the fluoride in the water is so well below any possible levels. I mean, it has so much years of good evidence. It's crazy, but so many things are crazy these days in public health. That's like, you know, it's crazy. Fluoride take the water. But yeah, I love it.
We actually have some natural fluoridation in Ulster County. So our water actually has 0.3 parts per million of fluoride already. The recommended level is 0.7. So we're almost halfway there. We just need to add a little bit, and then the kids will have the right amount.
That's the city water supply.
Yeah, as of the 60s, it had 0.3. I don't know what the current level is, but
Yeah.
we already have some. So, you know, people that are freaked out about it, we've already been drinking a little bit of it for a long time and we're fine. So, you know, let's get the optimal amount and fine tune it.
Any other thoughts or questions? All right. It's up to you guys if you want to continue this conversation or move it forward. So I'll leave it up to you. What you'd like to do?
I think if there was, you know, a specific action like, you know, the support of this commission or whatever that's I don't know, however you would go about trying to make that happen, that's something.
right, like, is there a clear ask of the commission at this?
Yeah, people would typically do, if there was a letter, so if you wrote a letter that you were gonna present to the common council, then you send it to us and we would say yes or no if we wanted to support it. And write a letter that goes with it. Or, yeah, it doesn't have to be a letter, it can be, if you're going to the common council, then would be a proposal for us.
There's also other avenues, so you could also write a common council person and they can bring it up to the common council. It could also just be an administrative, I'm not sure if it should be policy or administration. So, anyone could meet with the mayor and also ask him about it. And so, but then if it becomes, like city code, it can come through this, we are, I'm getting tired. We are a commission that gives recommendations, so we do not control the budget. Things that we can recommend to the common council. And so that can come through this commission, or they can also come directly through an alder. There's a couple of different venues there, but I think the action is if someone wanted to present that request to the common council or to us, then consider.
Okay, great. Well, I'm glad, you know, just verbally, it sounds like you guys are at least considering it. So if I have an official ask, you know, as a next step, I'll send it to Emily and you guys can decide if you want to officially support it or whatever. So I appreciate your time. Thank you.
Awesome. Thanks for joining us, Alex. Nice to see you. All right, everybody. That most of the rest of the agenda is just some quick things to go through. Some announcements and communications. We're not going to see you all officially until September. So Live Kingston is tabling in Town Day Diverse Day, July 15th from 4 to 7. Please come say hi. And the Kingston Farmers Market, July 19th from 9 to 1. As I mentioned, there's no official meeting in July and August, but in July, I am planning at the same meeting time. So the third Wednesday at 4:15, we're gonna talk about communications. So if you're all here and interested, please join me then. So I will send out a meeting reminder as I usually do. And I think depending on how that conversation will go, either we will meet again in August, either to continue that conversation or maybe talk about development. I'm not sure yet. First, I want to just see how July went. That's all I've got. Does anyone else have any other announcements or communications they'd like to share? Oh, I do have one more. Just kidding. Not this Friday, next Friday. Finally, the project that I've been working on for 2 years, Post Office Park, we're doing a ribbon cutting. I'll send you all an email with this graphic to invite you all, but I'd love it if you could join. We'll have free hot dogs, ping pong games and chess, and then we'll do a big ribbon cutting. And then we can walk around and see the new park we've created here in the city.
Where is it?
500 Broadway's at the other side of the park.
500 Broadway is right here.
So pretty.
It's these two new grounds.
Really nice. Yeah,
Yes.
I didn't know that's what it was called.
Yes, it's where the old post office used to
Oh,
be.
for my time.
And before the ribbon cutting that morning, a sculpture commemorating the post office will be placed. So there's gonna be a new sculpture and there's new signage at the park that talks about the historic post offices.
Yeah, that's awesome.
All right.
Place up a meeting, there's shade.
Nice.
Have a good dinner.
Good place for lunch, especially with Stone Soup, Dallas, all of our food options right here. It's a nice place to grab food and sit. All right, last call for anything else.
Can I just make sure
Yes.
people are checking out Kingston Spotlights, our very cool campaign that's going on our social media accounts. It's on Instagram and Facebook. And then there's a newsletter that came out last Monday and one that's going to come out this Friday. So if you are signed up for our department's newsletter, you will also receive that because I'm sending it to everybody. And it's interviews with folks that are related to have been partners of our Creating Healthy Schools and Communities grant, where we really wanted to going into the final year of this grant and considering just everything going on and this political and social environment, really uplift these stories of our incredible partners. So there's beautiful photography, interviews, quotes talking about how essentially they're just like creating good community and a healthy community. So like today was a chef from Chef Epic from Common Table, who led one of the cooking workshops for us. Yesterday was Joe Begans, who is the KCSD food service director. So it's like it's 9 different interviews that are being posted daily. So and then one of the radio shows later this summer is like, check. But keep an eye out in your inbox on Friday for the communications. You don't get them all at you right now.
Anyone else?
Yeah, anyone else I right now.
Yeah, oh, Arlene might not be on there.
Yep.
That makes sense.
I'll try not to be hurt.
I'll put it on the brain. You have to like opt into it, so don't like just spin out everybody.
I move to adjourn.
Second that, sure.
All in favor?
Aye.
All right.
Okay,
Sure.
Hi, Daddy.